And what I'm getting at here is you talked about insulin resistance. I want to talk about that spectrum that can happen over a 10 to 20 year period when somebody is abusing carbs and sugars, how that physiology goes awry in the body. And then when you take that to the extreme, that's type 2 diabetes.
Well, if you leave something chronically inflamed over time, it's just going to stop working. I talk about the Maillard reaction as a cooking term. I don't know if you've heard me talk about that.
This is what I wanted to get into, the AGEs.
Yeah. So, but again, to visualize it, I've actually given this explanation to endocrinologists, diabetes specialists, and they've gone, "Oh, okay, yeah, I understand." I mean, why on earth am I having to give them that lecture? But anyway. So a Maillard reaction is a cooking term. Everyone's aware of it. It's the browning of food. So if you, and what happens is effectively if you combine heat and, if you put heat across glucose and protein, it combines together and it's called a glycosation of protein. Exactly the same situation occurs in our bodies. If our blood glucose goes up, and the body does everything in its capacity to keep the blood glucose down. We think about glucose being essential, and it is, but the bloodstream does not want it in it. And that's, again, those other talks. It drives it out of the bloodstream as quickly as possible under the effect of insulin primarily. So, but what happens is if you've exhausted that system, if you've moved into an insulin-resistant state, the glucose you eat, the carbohydrate you eat, spills into the bloodstream, and that blood glucose is an elevated blood glucose. That's called diabetes. And it may happen even transiently if haven't been given a diagnosis. But every time the blood glucose spills over into the bloodstream, 75-80% of that then gets into the tissue under osmosis, just moves across the wall. And there, under the effect of body heat, that glucose combines with the protein, and you get glycosation of that protein, or glycation of that protein, and that becomes the Maillard reaction. So effectively, every time your blood glucose goes up, you are effectively toasting a little bit of your brain, a little bit of your eyes, a little bit of your kidneys, a little bit of your blood vessels, a little bit of your skin. And so we end up seeing all of those byproducts building up over time. So you might have a big carb meal now and totally unaware that you just toasted a bit of your brain. But over a period of 50 years or 70 years, not 10 to 20, then you've got dementia. If you do the same thing, then you've got chronic kidney disease. You've got eye troubles. You've got macular degeneration. You've just got the development of cataracts. You've got the development, combining that with the calcium that gets laid down in the blood vessel, then you've got cardiovascular disease. And it's a slow, damaging process. It's like a Chinese water torture. You just drip, 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 and over a period of time, it just becomes an unassailable force. Now, the body's got all these mechanisms to repair it. But the trouble is, if you're impairing your repair mechanisms, you're impairing your immune system. It's all completely tied up. Their ability to repair cells. There's a thing called lymphocytes called T killer cells. T killer cells are the first line of defense against viruses. They're also the first line of defense against cancers. When you load them with fructose, you load them with alcohol, then they don't work as well. So not only are we damaging tissue slowly and inexorably over time, we're also damaging our repair mechanisms. And it all comes back to what we're eating. So we can either change the way we eat, or we can try and medicate our way out of it. And people say, it costs time and effort. This is costly to eat this way, eat fresh, local, seasonal. So, well, it's actually not. If you're actually eating your local produce rather than food miles attached to it, then it's not a lot more expensive. And one of our daughters did a lot of work on this some years ago to actually work out exactly the food guideline cost versus eating this way. There's no difference. In fact, it was cheaper. What it is expensive in is in time. So it takes time to actually produce your food. But welcome to the old family scenario of people preparing food as a family, preparing it as a community, sitting down, having time over a meal, and all the social benefits of that. But I've said to patients, look, I get it. It takes time. You've got a choice, however, of spending that time cooking the food now and preparing it and spending time as quality time as a family, or spending that time in my waiting room and becoming a medical tourist and actually go, okay, what are we doing this week? Oh, we've got an appointment here, we've got an appointment there, we've got an appointment there. So you've got a choice this time now on good quality food and family, or spending that time as a result of that chronic low-grade damage in doctors' offices. It's a no-brainer to me. I wish I'd known about it a lot earlier, and I'm sorry I got caught up in the propaganda.
You got into the detail of the browning of the organs when the glucose is elevated. There's also the whole aspect of that insulin resistance continuum of insulin being raised and causing its own host of problems.
So insulin is primarily, it's a hormone secreted by the pancreas. So when your blood glucose goes up, insulin gets secreted, and insulin's primary role is to actually turn that glucose into fat, move it out of the bloodstream into fat storage. It's also got two other major effects. One is as a tumor promoter. So insulin is a growth factor. It's the most potent growth factor we have for tumor progression or tumor growth. So those people who are very insulin resistant, and classic is patients with diabetes, have a much higher rate of cancer. That's just an example of it. But the mechanism is it's insulin is producing or promoting that whole metabolism of cancer, and particularly alternate metabolic pathways, a thing called the Warburg effect. Again, there's a talk of mine on cancer where I go into that insulin. The really interesting one for me was in 2020, a couple of Chinese papers showing the effect between insulin and inflammation, and particularly in relationship to osteoarthritis of the knee. So I say not everything bad came out of China in 2020. So sort of it's really interesting. So under the effect of insulin, inflammation in the knee goes up, and they reduce the insulin to the cartilage cells, and the inflammation went down. Now, I know that paper was not written by a low carber, because the conclusion at the end is, we should be targeting insulin with drug therapies in the management of arthritis and inflammation. No, I mean, that's the complete no-brainer. The thing is, if you don't eat carbohydrate, you'll reduce the insulin, and then you'll reduce the inflammation. Now, particularly in my knee patients, I've got many, many, many people over time who actually simply, with end-stage arthritis of the knee, go low carb, and within 6 to 8 weeks, their pain disappears or improves dramatically to the point of them not needing an operation. So that's the practical side. If you've got arthritis, look at inflammation first. Look at your diet. If we look inside and you talked about advanced glycation end products, AGEs, and other. There's another group of things called the metalloproteinases, which are issues related to inflammation in joints and tendons. So tendons around the shoulder, Achilles tendons. If you look at those tissues, you find the end products of glucose metabolism, advanced glycation end products. Glycation is glucose in there. You do not find the end products of protein metabolism. You do not find the end products of fat metabolism. So the primary inflammatory mechanisms that are abounding in our joints and our tendons are a result of our carbohydrate metabolism. I did try to find information related to the discs in the spine, because I thought that would be brilliant if I could. So, my cognitive dissonance is I actually tried to find it and I couldn't. But there are facet joints around the back of the spine which are going to have the same issues related to carbohydrate metabolism and arthritis. I just think, and so all of that's glucose metabolism and insulin effects. So if we're in a chronically inflamed, chronically high insulin state, and we've got a poor diet, do we medicate our way out of it, or do we lifestyle our way out of it? And there's only one sustainable option there, and that's
I agree.
LCHF.
Just for clarity there, the Maillard reaction and the AGEs, I thought the AGEs were the browning of the tissue, the Maillard reaction. Is that different?
Yeah, they're different. So,
okay, can you clarify that?
Well, no, the Maillard reaction is a glycation of the protein. So that is just a direct chemical effect. Advanced glycation end products are byproducts of an inflammatory process, which also release oxygen-free radicals. So the AGEs are the next step down the line from that Maillard reaction. So once you actually get the Maillard reaction, that glycation, then there's some inflammation related to that. And as that breaks down, that's the advanced glycation end products. I'm trying to make that as simple as I can, I think. So the browning effect, that toasting is a primary chemical reaction. The byproducts of that are the advanced glycation end products, of which release their own inflammatory oxygen-free radicals.
Got it. Glad we clarified it, because I thought it was the same thing.
The other thing is there's stuff coming out now about it. Stuff meaning there's good research coming out about it. Because this is, and again, there's no money in it for the pharmaceutical industry. There's no money in it for the food industry. But there is some science coming out, lesser known laboratories, people who are interested in it, showing a whole lot of stuff. I can't wait for another 10 years. The studies now are great, more and more studies coming about doing this intervention, not just in diabetes, but doing it in mental health, doing it in gut disorders, doing it in non-alcoholic fatty liver disease. I'm aware of many papers being done. I'm aware of pre-results, and using this intervention particularly in diabetes, not just type 2, but in type 1. There's a group in the world called Type 1 Grit. I'm very proud that I helped them get off the ground some years ago. I think there's 30-odd thousand of them now. Those ones that are doing low carb in type 1 diabetes are the best 0.3% controlled type 1 diabetics in the world. So diabetes, type 1, type 2, whether you consider it type 3 dementia, does not need to be a chronic progressive disease as it's continued to be promoted by the diabetes foundations of the world. It is something that if you go hard at it with a low carbohydrate intervention, those people have the ability to turn around their type 2 diabetes, put it in remission, or children or in adults potentially have normal life expectancy with type 1. And so these studies are now coming out, but they're not mainstream because that doesn't go with what we've been told and what the propagandists continue to push down our media pathways. It's a very rewarding path to travel personally. You don't have to do it all at once. Again, another daughter. It sounds like I've got hundreds of daughters. I don't. I've actually got 2, but she used to ring up and said, "Oh, Dad, she was at university. She said, "Oh, I've just had 4 ice creams." She had an ice cream binge. I said, "Don't worry, darling." I think I must have had 10 of those phone calls. So she fell off the bandwagon 10 times. She's now a mother of 2, and she's doesn't fall off the bandwagon. So it's a bit like smoking. If you want to give up smoking, give it a crack. If you fail once, it's not the end of it. You come back and do it again. You come back and do it again. And so and if it's a transition for you, or if it's a one-off hardcore transition, doesn't matter. Any lifestyle change needs to be done with your own knowledge and with the support of those around you. And one of the problems of low carb, healthy fat is actually we're surrounded by a society that is constantly trying to undermine your position on this. There's marketing at the supermarket, there's marketing at all these beautiful Whole Foods and beautiful round, brown paper bags, which are actually all from the cereal industry, all to make you feel good that it's a natural product, when in fact it's going to undermine your pathway. And if you lose weight, a lot of people in the workplace are going to go and go, "Oh, you're not eating cake," and they're going to wave cake underneath your nose. Welcome to human nature. It's about undermining your success. It's tall poppy syndrome. If you are going to do this, you are taking back control of your life. You are empowering yourself. You're empowering your family. And people are jealous of that. I'm not 100% right. I'm not perfect on this, but I'm in far better. My health, I've now taken control of my health, which I didn't have control of 15 years ago. I'm still aging. I'm still ugly. I'm still going to die. I can't do anything about that, but we can all empower ourselves with that knowledge. And if we're privileged enough to be able to take on that pathway, then give it a crack. If you do it for a lifetime, that's great. If you do it for, there's been a criticism of saying, "Oh, it's only been shown to be beneficial for 6 or 12 months in diabetes." Yeah, so do it for 6 or 12 months and see if you can continue. The long and short of it can go on for years without side effects, because it's a complete dietary lifestyle change that does not require supplementation, apart from maybe the magnesium. I can't say any more. I don't know. I can keep repeating myself. I'm good at that.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Once you understand where the non-science is coming from, where the propaganda is coming from, and it is industry, pharmaceutical, and religious ideology, now I understand why I was conned in my medical education.